Today's lecture is on microbial interactions and pathogenesis. So we have normal microbiota that colonize our skin, digestive system, genitals, urinary and respiratory system. And pathogens are disease-causing microbes. So they have certain adaptations that allow them to interact with us and our tissues. So pathogens can definitely be dangerous then to a host. Now, opportunistic pathogens, again, are agents of disease under certain circumstances, such as when a patient is immunocompromised. So, for example, E. coli in the appendix might get into the abdominal cavity, and a weakened immune system can also allow for things like yeast infection to occur. So, two terms to know: pathogenicity, that's the ability of a microbe to cause a disease, and virulence, that describes the degree or extent of disease that a pathogen causes. Now, there's virulence factors that are out there, and that's how a lot of these microbes overcome our innate types of defenses. So again, this just gives you an idea of some of the things that microbes or pathogens might produce: toxins, quite a few of those, immune system evasion, and they can invade by producing different types of enzymes, etc. So a term also to know is infectious dose 50 or ID50. That's the number of cells or virions needed to establish an infection in 50% of the exposed population. So the more infectious a pathogen is, the lower its ID50 is going to be. So toxins are really major types of virulence factors, and two classes of toxins to be aware of are what are called endo and exotoxins. Now, an endotoxin is released when the cell wall is broken, and a good example of an endotoxin is lipopolysaccharide that is found in the cell wall of a gram-negative bacteria. So it acts as an endotoxin. Exotoxins, on the other hand, are toxic, and they are secreted from the cell. So they will be produced inside and pushed outside of the cell. So how do we get an infection? First, it has to enter. Then it has to adhere or stick. Then it will invade tissues, and it gets some nutrients from us, replicates while it's trying to fight off our immune system, and it can also be transmitted then to a new host. So things get in a certain way: mucous membranes. Sometimes you might scratch yourself and a pathogen gets in that way, etc. So there's different ways that they can get in. So things can get in through your eyes, for instance, or your ears, respiratory system, GI tract, urogenital tract, etc. So these are all the different ways things can get in. Also, things can be injected into your system as well. Sometimes viruses in particular can cross the placenta, but other microbes can do that as well. So these are just the ways that you can get an infection. So, a very important part of establishing an infection is that the pathogen has to be able to adhere. So, the term adhesins are used because those are virulence factors used to stick to host cells in a specific or non-specific manner. So there's different types of things that could be included in that: capsules, fimbriae, pili, etc. These are all ways that microbes can stick to us. Now, biofilms can also form when a lot of different microbes will come together. Some of these are natural. Some of them are man-made, unfortunately. According to the NIH, 60 to 80% of human infections originate from biofilms. So some common places that you can get biofilms: things on implants, catheters, prosthetic joints, deposits in your kidneys, like kidney stones, for instance, or gallstones. So here's two examples. This down here shows some different microbes that were found on a urinary catheter. And up here, plaque. Plaque is a great example of a type of biofilm that can form. So what are the effects then on our cells if we get an infection? Well, one thing that can happen is you can kill off the cell. So if it lyses, then it's going to be dead. But sometimes they just damage the cell in other ways. The cells can grow, but they're not going to be doing a good job of surviving. Now, what can happen then for the cytopathic effects? The microbe invades our host cells, releases toxins, starts to eat up some of our nutrients. So bacteria can do that. Viruses can disrupt our cellular functions. They can get released from us. And in some cases, with oncoviruses, they will transform normal cells into cancerous types of cells. So not only do microbes get in, but they get out. Feces, urine, bodily fluids, etc. are ways things can get out. And sometimes the way that they get out is the same way that they actually get in to our bodies. So again, things can be secreted out of your ears, eyes. You might have pus that's going to drain from a wound, etc. So these are all the different portals then of exit from our bodies that microbes and viruses can take. So one of the things that's very important for us to be aware of is what's known as biosafety levels. And you have to handle different types of pathogens in different ways depending on how infectious they actually are. So we look at the level of infectivity, so biosafety level BSL, also extent of the disease, mortality rates, how is it transmitted, and availability of preventions and treatments. So right now, when we look at COVID, we don't really have at the moment a vaccine or a treatment, so that pops up the safety level, which is why the social distancing and stay-at-home orders are in place, because we don't have those treatments yet. So please know there's 4 biosafety levels, 1, 2, 3, and 4. So for BSL-1 agents, please know the examples would be Bacillus subtilis, E. coli K12, and Staphylococcus epidermidis. They're very well characterized. They very seldom will cause disease in healthy people, and they pose a limited threat. So they're actually not that dangerous. Now, as we move up to biosafety level 2, these are infectious, but they're not airborne. So any kind of bodily fluid is treated as a BSL-2. So 2 that I'd like you to know for the exam are Staphylococcus aureus and herpes simplex. So while they're infectious, again, most of the time our immune system is capable of taking care of them, but not all of the time. So they're in a biosafety level 2 category. Now we do have a biosafety level 2+, and a good example would be HIV. Now they're dangerous, they're not curable, there's no vaccine, but we have to ramp up our safety practices when working with these. Now for biosafety level 3, these are serious. They're lethal. And they can have airborne transmission. So some are treatable, but some are not. So there's about 2,000 BSL-3 facilities in the United States, and entry to these facilities is restricted. So the 2 examples I'd like you to know in this category are Coxiella burnetii and Mycobacterium tuberculosis. So any of you who work in healthcare now already know that you have to put a TB patient in isolation. They can't be in a regular room with another patient. And finally, the highest level, BSL-4. These are dangerous. They tend to be lethal. There's no cures or treatments at all. and there's only about 15 of these facilities in the U.S. Two examples would be Ebola and Marburg. And if you look, you have to wear these special kinds of hazmat suits here, and this actually is a bubble over that person's head, and it's all got to be contained. It's got to be airtight, and that's the only way you can work with these types of pathogens. So we have our standard precautions then and transmission precautions, and anyone who works with patients or works in any kind of a lab has to take these precautions. So our universal standards are limiting transmission then of bloodborne pathogens, and it's important to keep in mind all patients are treated as potential sources of bloodborne or other infectious agents. So always, always, always use precautions when you are working with your patients. Please take a screenshot of this. This is something that we should be doing. Always washing your hands, always. Before and after you work with a patient. Change your gloves in between any tasks or procedures. Barrier clothing, things like face shields or masks, should be worn. Always make sure any sharps go in the proper sharps container. Disinfect surfaces. Laundry and garments need to be cleaned at all times. Again, prevent direct contact, droplets or airborne. So again, masks or shields or something like that. Make sure that when a specific infectious agent is suspected or known to be present, so ramp it up a little bit. And make sure that if you have a patient in isolation, that's posted. So it's not only for the healthcare providers, but also visitors who may have to take their own precautions before they enter that room. So minimize transmission, barrier gowns, disinfect again, patient transport should be limited, and any kind of equipment that's used should only be used for that particular patient. Again, masks, etc. And a lot of times you might have a person in a negative pressure room. So that's to reduce the risk of that pathogen getting outside of that room.